Thank you all for joining us today, and thank you to Bob again for providing your information today. My name is Megan. I'm a research assistant at Benjamin Rose Institute on Aging. Thank you for joining us today for celebrating milestones in elder care. Today, we will be discussing pivotal pieces of legislation that have transformed elder care in the United States and where they stand today, including the Elder Justice Act, the Affordable Care Act, and the National Family Caregiver Support Program. This webinar will be recorded. You may submit a question at any time using the chat or Q&A feature at the bottom of your screen. We have staff monitoring to convey your questions to our presenters and to answer any technical questions you may have. You can turn on captions by selecting live transcript, the button with two C's at the bottom of the screen. I will now turn it over to Benjamin Rose's President and CEO, Orion Bell, who will introduce today's speaker.
Very good. Thanks so much, Megan, and thanks everyone for joining us today. It is my honor to introduce Bob Blancato as our speaker today. Bob is the president of Matz, Blancato & Associates in Washington, D.C. And in that capacity, he serves as the executive director of the National Association of Nutrition and Aging Service Programs and the national coordinator of the Elder Justice Coalition, as well as the national coordinator for Defeat Malnutrition Today Coalition. Bob's prior work includes more than 20 years of public service, including 17 years as a senior staffer in the House of Representatives. He was appointed by President Clinton to serve as executive director of the 1995 White House Conference on Aging, one of four he has participated in. Bob is a member of the Senior Executive Service. He is recognized as a national policy advocate for older adults and has testified on numerous occasions before Senate and House committees, most recently in 2022 before the House Appropriations and Labor, Health and Human Service Education Committee. As a volunteer, he currently serves as the second vice chair of the AARP Board of Directors and is a member of the AARP Foundation Board. In 2024, Bob was appointed to the Next 50 Foundation Board of Trustees, and he serves on the National Hispanic Council on Aging Board and previously served as the chair of the American Society on Aging and the board of the National Council on Aging. Bob has been appointed to several federal advisory commissions, most recently the National Advisory Committee on Rural Health and Human Services. And Bob was inducted into the American Society of Aging's Hall of Fame in 2022, and in 2023 he was awarded Generations United Highest Advocacy Award. And so with that, welcome Bob Blancato.
Orion, thank you very much for that nice introduction, and thank you for your partnership as we continue this webinar series with ourselves and the Elder Justice Coalition. And thank you separately for your leadership at this very difficult time in the world of aging, in the world of human services and social services. I think these webinars have proven to be more valuable perhaps than in previous years because it's conveying education, but it's also serving as a vehicle for advocacy, which we all know is more important now perhaps than it has been in any time soon. So I appreciate the opportunity to participate in today's webinars. I have in previous ones. And Julie, thank you very much for the, people are saying the audio is breaking up. I'm just seeing a sign here. So just as an FYI. So Julie, let's go to the first slide, and thank you so much for moving the slides because there are a few. So when we began this plan for this webinar, we were going to be doing pretty much a celebration of the various anniversaries that we have this year, including Social Security turning 90, Medicare, Medicaid, and the Older Americans Act turning 60, the National Family Caregiver Support Program turning 25, the Affordable Care Act with the Elder Justice Act turning 15, the Americans with Disability Act turning 25, and I have one more I'll slip in a little later that was alluded to, but and I'll also point out this is my 40th wedding anniversary year, so it really is the year of anniversaries, and you know that's we could celebrate that separately. So I'm going to first give the highlights of these programs and their history, and I know there are a lot of people on this webinar. I'm looking at the numbers that they keep coming in. If there are history buffs that see I missed something in the history of these different programs, please throw it in the chat or the Q&A, and we'll be sure to make sure we have it. Let's go to the next slide. So talking about Social Security, It was signed into law on August 14th of 1935. This is before Orion and I were even around. We're sure of that, right, Orion? We're not, we're not 90, so we're good. So today, more than 53 million people, or nearly 9 out of 10 people over the age of 65 are in Social Security. And 90 million are 100 years and over. But there are not the number of people 150 years old who are getting Social Security that has been contended by certain people in Washington. That is not the case. Original program only covered workers over 65. The first Social Security numbers were given out in 1937. The cost of living adjustment, which is so important to older adults, began in 1972. And for those of you who know about Social Security, that is based on the inflation rate at a given point in the year. And some years the cost of living increase can be as high as 7 or 8%, and some years it can be like less than 2%. The 1983 amendments are particularly interesting to me because I was a staffer on the House Committee on Aging at that time. And the actuaries came to Congress and said, if you don't put some new revenues into the system, we're going to have trouble making our benefit payments in 1984. Well, 1984 was an election year, a presidential election year, a congressional election year, and you can be sure there was no senator or no House member who wanted to be in the Congress when Social Security missed its first payroll. So they all went to work and said, okay, we're going to come up with a plan to save Social Security. And they came up with a plan, and it was a very complicated, difficult vote for many members of Congress because the bill raised the retirement age to 67. It taxed benefits for people for the first time on Social Security. It delayed that cost of living increase for 6 months, but the alternative was insolvency, okay, which no one wanted to see. 1999, Social Security ended paper checks, and the United States was a model for Social Security systems worldwide. And let me ask you one other demographic fact that's probably worth noting, and this will come to bear, I think, in the years ahead. When Social Security was signed into law by President Roosevelt, the ratio of beneficiaries to workers was 5 to 1, 5 workers for every beneficiary. Today, that number has shrunk to 2.7 to 1. So that's something to keep an eye on going into the future. Next slide. So the summer of 1965, and where I was around at that time, I remember it was a good year. I was a teenager. It was a lot of fun. But there was a lot of things going on in Washington and around the country at that time. We had something called the Great Society that was embarked upon by President Lyndon Baines Johnson. And during 1965, we saw the introduction and passage of what we call the Aging Program Trifecta, the Older Americans Act, Medicare, and Medicaid. Okay, perhaps some people still view the Great Society as one of the greatest domestic policy eras in our nation's history. These 3 programs were prompted by 2 realities. One was the growth in the aging population, and 2 were gaps in services that were being offered or provided, things that needed to be filled, like healthcare, like social services. And as you can see in the bottom, you see President Johnson signing the Older Americans Act at the White House, and then going out to Independence, Missouri, to be with former President Harry Truman for the signing of the Medicare and Medicaid law into. Yeah. So next slide.
Bob, I just want to interrupt. There's some questions in the chat about 90 million individuals.
Yeah, that's right. Probably it's 90,000. I think that was a typo. Thank you for.
Okay.
See, this is a good crowd. This crowd picks stuff up, and my colleagues in my office will hear about this later. But thank you for picking it up, and we go from there. So let's and keep me honest, guys. If you see something else, just pop up and let us know. So, the Older Americans Act, a program that we all have a great regard for, whether you're in Cleveland or in Washington or whatever. It was signed into law on July 14th of 1965, so it is celebrating its 60th year. The nutrition program, which is still the largest program in the Act, began in 1972. And a little side story with that, some of you are familiar with demonstration programs, where you test out an idea to see what it's like, and if it has the ability to be scalable, it can become a national program. Well, that's how the nutrition program began, as a small group of demonstrations around the country that ultimately became part of the Older Americans Act in 1972. We added coverage for tribal organizations and Native Americans in 1975 under Title VI of the Older Americans Act. The vulnerable elder rights activities were added in 1992 as Title VII of the Older Americans Act, which includes the Long-Term Care Ombudsman, Adult Protective Services. Based on Administration for Community Living data, some 11 million people are served yearly in the Older Americans Act. And then, of course, the Aging Network that many of us are familiar with was established in 1973 and now consists of 56 state units on aging, 291 tribal organizations, 615 area agencies on aging, and more than 22,000 local service providers. Next slide. Now, within the Older Americans Act in the year 2000, a very important amendment was added to the act, create a first-time National Family Caregiver Support Program, which grew out of the 1995 White House Conference on Aging. And this program provides training and related services to family caregivers, serves over 700,000 caregivers annually, including grandparents, which, by the way, was really a motivation that led to the creation of the Family Caregiver Program, was the growth of the number of grandparents raising grandchildren in this country. And as we look at some of these data, 74% of the people in this program report they were able to give care for longer because of the Family Caregiver Program. 88% report that the services and the training helped them be a better caregiver. And 62% of caregivers report that without these services, their older adult could be living in a nursing home. So the value of this program continues as time goes forward. Next slide. So Medicare, which became law on July 30th, 1965, now serves 67.3 million, that number is right, annually. We have 12 million dual eligibles in this country who have Medicare and Medicaid coverage. The law that was passed in 1965 finally recognized that we have a financial responsibility for health coverage for older adults. At the time this passed, older adults paid 3 times as much for coverage, and only 60% had health insurance at the time Medicare was established. Boy, you can't make this stuff up. I'm just watching 3 police cars pull right in front of my office, and I don't know why, but let's hope it's not for me to get out of here because I didn't do anything. So let's hope for the best here. This is live theater here, folks. The Medicare Advantage program. Now, some of you know there's 2 kinds of Medicare, fee-for-service Medicare and Medicare Advantage. That started in 2003. What Medicare Advantage is about is providing a range of services not covered by fee-for-service Medicare that has found a great amount of interest among people who are enrolling in Medicare, particularly younger Medicare beneficiaries. Prescription benefits were added in 2006 under Medicare Part D. And then we have the very significant Inflation Reduction Act of 2022, which did a number of things very important to Medicare and Medicare Part D. It expanded benefits and lowered drug prices. For example, insulin was capped at $35 a month for people on Medicare. You have access to recommended adult vaccines without cost sharing, which has become very important from the time of the pandemic on. For the first time in history, beginning this year, we have a yearly cap of $2,000 in out-of-pocket prescription drug costs. And then finally, the one that gets the most of the attention, for the first time in Medicare's history, it was allowed to begin to negotiate prices under Medicare Part D. And as many of you know, the first 15 of those drugs have been chosen, and the negotiations are beginning, and there will be another round to follow later in this year. So this was a major big deal, and perhaps one of the most significant bills to pass since the actual Medicare bill passed in 1965. Let's go to Medicaid next slide. So this became law also on July 30th of 1965. Today, with 72 million individuals enrolled, 12 million Medicare, again, 12 million was dual eligibles. More than 60% of nursing facility residents are on Medicaid. 1997, it expanded to cover more children under the CHIP program. And as I'll talk about later, the Affordable Care Act added a whole number of millions of people to the Medicaid rolls through Medicaid expansion. And not on here, and I'm going to make this point separately, was another important development in Medicaid started about 5 years ago in an area called rebalancing, when for the first time in Medicaid's history, it was covering more for home and community-based services than it was for institutional care, which was something which advocates worked for, which the public wanted, and that is now a reality today. Next slide talks about the Affordable Care Act, which became law in 2010. Today, with 20 million people impacted in one way or another by the Affordable Care Act, nearly 1 in 7 Americans have had ACA insurance at some point since 2014. This particular statistic is very important. The uninsured rate dropped significantly from 16% to 4% because of the Affordable Care Act. We also know the Affordable Care Act ended healthcare coverage discrimination for pre-existing conditions. It closed the donut hole under Medicare Part D, where you end up paying more if you reach a certain threshold. This next point, I think, is very significant for not only now, but for the future of Medicare. And that is the expansion of preventative benefits. You know, some people say, well, the boomers have, influenced so much in this country. And when boomers started turning 65, we started seeing more of an interest on their part in having a Medicare that would cover not just when you got sick, but it helped to keep you from getting sick. So there were more preventative benefits added to Medicare in the past 10 years than there were in the previous 40 years. And the Affordable Care Act had a lot to do with that great expansion of preventative benefits. The ACA also created the Center for Medicare and Medicaid Innovation, which, for those of you who are in the healthcare space, you know how important innovation is for looking ahead to our healthcare needs. And then, of course, as I mentioned earlier, it expanded Medicaid expansion to 41 states, and 25 million new enrollees came about from the Affordable Care Act and the expansion of Medicaid. Next slide talks about a piece of the Affordable Care Act, which was the Elder Justice Act. So now, if you remember, Congress, and I gave you a bill that was modest in scope and size, that was bipartisan, and was going to help older adults, how long do you think it would take to pass a bill like that? And I get answers like 1 year or 2 years. It took 7 years from the day this bill was introduced till it became law. And even then, it could not pass on its own. It had to be passed as part of a larger bill, to be added onto a larger bill, just because that's the way the process was back in 2010. And, there was tremendous bipartisanship in the early days of this Elder Justice Act. On the Senate side, we have folks like the late Senator Hatch, Senator Grassley, who's still in the United States Senate, were leaders on this issue. And Democrats like Senator Lincoln and Senator Wyden were very involved. On the House side, we had Congressman Peter King from New York, a Republican, and Congressman Rahm Emanuel from Illinois, who was a Democrat, all of whom, at one time or another, were the sponsors of the Elder Justice Act. But what was important about the Elder Justice Act and why it happened was the realization that we were spending less than 2% of all the money we spend on abuse prevention in the United States at that time. Less than 2% was going toward elder abuse, even though the numbers were rising. So what did this bill do? First of all, it's the first time we had a federal response ever toward combating elder abuse. It created a home and first time dedicated funding for adult protective services, which is the main front line of dealing with elder abuse, not only from the standpoint of helping victims, but also in the terms of preventing elder abuse. It provided greater training and support for the long-term care ombudsman program, the folks that work in the nursing homes who report abuse to the appropriate authorities. It led to a number of reports being generated by the administrations at the time. The Department of Justice produced one called the Elder Justice Roadmap. The National Center on Elder Abuse was established through the Elder Justice Act. And the last one of these may have been the most important thing done by the Elder Justice Act. The Elder Justice Coordinating Council. Now, for those of you who are not from DC, you probably go, there goes Bob talking DC again with some term like Elder Justice Coordinating Council. Well, let me put it in layman's terms. What this council does is takes all the federal agencies that have some role in elder abuse prevention and can have them come together to work out a plan for a more coordinated response with their existing resources in the area of promoting elder justice by preventing elder abuse. When this council started, it was about 10 members. Now there are 17 different federal agencies working on this issue on a regular basis. And I would also point out that this process began in the Obama administration, carried in seamlessly in Trump first administration, continued on in the Biden administration, demonstrating that there is bipartisanship in relative to working to prevent elder abuse in this country. Next slide talks about another important bill that we're celebrating the anniversary of, the Americans with Disabilities Act, which became law in 1990. In 1973, we established the fundamental civil right of non-discrimination against people with disabilities. This law protects people whether they are born with a disability or acquire one as they age. It reinforces the right of older workers to work and engage in society without facing prejudice due to changes. Also protected our loved ones of disabilities. It makes communities more accessible to all, with 1 in 4 older adults having mobility challenges. And it covers the purchase of assistive technology for home and vehicle modifications to make independent living easier. All these things are products of the Americans with Disabilities Act, a significant landmark law that was passed. We're happy to celebrate its anniversary this year. And the one that was not on my early slide about, next slide, this one has to do with, I'm using a point of personal privilege here because I happened to be appointed by President Clinton to be the executive director of the 1995 White House Conference on Aging. And so we celebrate our own 30th anniversary actually on May 2nd, which was the first day of that conference. And, you know, it was the last White House conference of the 20th century. The first one was in 1961, then 1971, 1981, then ours in 1995, followed by the 2005 and the 2015 White House Conference on Aging. Ours was unique in the sense that it was one of the largest. We had almost 3,000 total people who came to our conference, partially because it was authorized by the Older Americans Act to have a conference. We produced, and it's interesting in this day and age, we produced 30 years ago a national policy on aging. And as many of you know, that same process began last year with the Administration for Community Living with a strategic plan toward a national plan on aging. Our White House conference, which was held in a very politically perilous time. In 1994, in November, the Republicans took over the Congress for the first time in 40 years. And they were looking at something called the Contract with America, and they were looking at aging programs to make some reforms, changes, and so on. The delegates who came to our conference in 1995 voted through resolutions to reaffirm their support for the programs, to have them strengthened, not weakened. And then, of course, as I mentioned earlier, this conference also introduced the issue of grandparents raising grandchildren. And in the wonderful state of Ohio, which, since Benjamin Rose is based in beautiful Cleveland, they had more than 80 delegates. The state did more than 15 pre-conference events, including one right here at the Benjamin Rose Institute on Aging back on February 23rd of 1995 on older women policy issues. So there was a personal tie, if you will, between the White House Conference and BRIA. So let's go to the next slide, and I want to offer this as something else to think about. So why do these big policies matter? Okay. To me, the simple answer is, what if they did not exist? How much worse would the health and economic security of older adults be without Social Security and Medicare? How much more difficult would it be for older adults to live in community with independence, like the Older Americans Act promotes and achieves? How many more older adults would slip into poverty without Social Security? And would our aging population even be the size it is now without these Great Society programs and Social Security? Look at the numbers. You know, 60 years ago, people 65 and over were 16 million total. Now we have 62 million. So we should take a moment and be grateful for the work and the leadership and the foresight of Franklin Delano Roosevelt in the 1930s and the Kennedy and Johnson administration and the various Congresses during that time period who were foresighted in the development of the programs whose anniversaries we celebrate this year. So Megan, before we move to phase 2 of this webinar, I see it as 34 different things in the chat. I don't know how many of them are, and 2 Q&A. So if you want to take a pause and see if we want to take some of them, I'm happy to do that and take a sip of water. So.
Sure. So there was a question about the continuation of the Elder Justice Coordinating Council during this administration, if we know that it will be continuing.
Well, you know, in this environment, the first 2 words we say is we hope. Okay? We have no reason to believe that it will not continue, since it was continued rather effectively in the first Trump administration under the leadership of Lance Robertson. It's just in the scheme of preparing for things, we have not seen any specific scheduling of anything for the Elder Justice Coordinating Council. However, the Elder Justice Coalition has communicated with the appropriate people in the White House to urge that it be continued and carried on as it has been in the past. And we will keep people posted by just go to our website and you can see any developments in that space.
Awesome, thank you. Another question came in about the ACL, just asking if you would just address the dismantling of the ACL, the immediate future impacts.
Well, actually, if you could just bear with us a few minutes, there is a slide that will come up that talks about sort of the ACL in today's space and today's environment. So if you could hang with us for a little bit, we'll come to that. And if you have an add-on question, we can add to it then.
Sounds good. All right.
So,
all the questions we have for right now.
So, Bob, I think, you know, as anxious as some of us are about the space and the aging network and the services, I think there's one hopeful thought is that, you know, the examples that you gave, there's always been a lot of bipartisan support for these initiatives and these programs that, you know, things that were started by FDR or the Kennedy and Johnson administration, but you also noted a number of innovations and additions that happened under Republican administrations. And this has always been a place where we were able to find a lot of common ground. So I think even as we deal with a lot of change, you know, I think there's still some reason to look for places where we can connect on this and continue to see opportunities that we can celebrate another 60th birthday or another 90th birthday for some of these programs going forward.
Well, excuse the noise. Again, using my favorite 2 words, we hope that is the case. If you were, since we are where we are right now, the slides that will follow that talk about there are probably more challenges and opportunities at the moment, but that is not unusual in public policy. That's not unusual in the history of public policy. But I think we need to confront some of the things that are facing us right now. And if we go to the next slide, I can say that, you know, we are approaching the summer of 2025. And I use the summer now because that's pretty much when a lot of the activity is going to happen in a lot of this area. We have more questions than we do have answers to many of the programs whose anniversaries we celebrate. Which program is most secure? Which is the most challenged? And where will advocacy be needed in the months ahead? And I'm going to say on that second one, a lot of places, because there's a lot of things that we need to speak up about. So let's go to the next slide, and let's start with Social Security. Well, you know and I know that everybody says we're going to protect Social Security. I don't care if you're a Republican or Democrat, if you run for president or you run for the Senate or House, okay? We will protect Social Security. Well, now for the first time in my memory, we now need to put that term in context. Is it just protecting benefits while you attempt to dismantle the agency that provides the services and the benefits? Can you really have one without the other? It's much too big a risk to find out. Now, since the time that this administration, led by its Doji or Doggy, whatever you want to call it. People use worse names than that, trust me. The government efficiency efforts. When they began to go into the Social Security Administration and try to rearrange a bunch of things, they came up with some really drastic suggestions, including ending phone enrollment for people, which obviously immediately discriminates against older adults and persons with disabilities who have to then make the trek to the Social Security office while the offices were being closed. So some of those drastic suggestions have led to tremendous pushback. And they already changed the phone enrollment thing. They modified it so that people pretty much can go back to doing what they were supposed to do in phone enrollment. But the real question is going to be, will more staff be brought back? Because without staff, you can't process benefit applications or provide, past benefits. So yes, people are protecting Social Security relative to making sure the checks go out, but there's more to protecting Social Security than we first thought. So go to the next slide. Now, from a policy standpoint, what could we see as a change, a major change? Well, for Social Security, will we see an end to the taxation of Social Security benefits that first began in 1983? Many of you know President Trump has proposed ending taxation of these benefits. Many of you also know that a tax bill is developing in the Congress as we speak. Question is, will this be included? And if it is, will it weaken, and how much will it weaken the condition of the Social Security trust funds? Now, for those of you who follow Social Security, there's something called the date of doom. Okay, the date of doom is the year that Social Security would have the benefits reduced by 25% if nothing was done to pump new revenues into Social Security. Okay, that now is in around 2033, and every year, the trustees come out with a report, and any year that date of doom moves up by a year or so, it causes concern. Okay, so there are estimates that say that if you get rid of the taxation of Social Security benefits, you could move that date of doom up by a year or two. However, if you find a way to put new revenues into the system, then you might be able to offset that loss of revenues. And the most popular of these revenue ideas is to raise the cap. You've heard this expression. Anybody who follows Bernie Sanders, you've probably heard Bernie Sanders say raise the cap for the last 10 years. The cap is this. If you make $176,100 in the year 2025, you pay Social Security during that whole time. If you make $476,000, that last $300,000 you're not paying Social Security taxes on. So now the thinking is that cap should be at least doubled so they could bring new revenue into the system. But at the moment, all that's being talked about is ending taxation of Social Security, but it isn't clear whether that can get done in a tax bill or have to be done in somewhere else. So I hope I just answered whoever just threw that question about the date of doom in, and if not, we'll come back to it. So let's go to the next slide and go to Medicaid. Now, this is where we got problems. I mean, this is where we really, 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 really have to focus. This is the Great Society program that's under the most threat. And, one of the things I'm the son of an anesthesiologist. My late father was a brilliant anesthesiologist. And if anybody knows what they do for a living, they put people to sleep. And I promised my late father that I would never emulate him while giving a speech of my own. But when you start talking about budget reconciliation, budget resolution, yada, yada, it starts to get like a little bit, tiring. But I have to do it because that's the way the system works here right now. So right now, Congress is in the midst of preparing to pass what's called a budget reconciliation bill. They have already passed the budget resolution, which is the framework by which they pass a later, bigger bill on reconciliation. Medicaid has been a subject of great discussion for about the last 2 months because somewhere along the line, somebody leaked a document, okay, no official document of any kind, leaked a document that said that Medicaid might have to get cut by $700 billion to achieve the savings necessary for a tax cut to happen. Because this is all in the same bill. Budget reconciliation includes taxes and cuts, okay? Well, when they put that number out in the street, the pushback was amazingly strong and totally bipartisan. Okay. Because you have states across the country with Republican governors and Democratic governors who say, you start cutting the federal share of Medicaid back to our state, we will have to cut benefits and take people off Medicaid. So now the struggle is, how are you going to achieve, and that $700 billion is not a real number anymore. Don't even worry about that number being anywhere near close, but there's still going to have to be savings achieved in Medicaid as part of a budget reconciliation bill. So how do you do it without cutting benefits? Well, certainly the most popular idea is to impose additional work requirements for people on Medicaid, even though a tremendous number of people on Medicaid are working poor people. But there are some who are not, and they perhaps can get more of them enrolled through work requirements. Now, this is a great question. How much fraud, waste, and abuse is there? Okay? It depends on who you talk to. Okay? If you talk to Elon Musk and his people, they think the whole country is filled with fraud, waste, and abuse. They think in the Medicaid program in particular, there's so much fraud, waste, and abuse that if you could weed it out, then you wouldn't have to worry about making cuts to benefits. But nobody's got their arms around that yet. Nobody's got the real number yet, but they have to do it soon because this bill has got to be dealt with in the month of May. And there's going to be some number that's attached to Medicaid in terms of savings. And if fraud, waste, and abuse can take care of it, along with maybe work requirements, then that will lead to no cuts in benefits and no people being knocked off Medicaid rolls. But we don't have that answer. As I sit here today with you guys, I don't have that answer. But come May 5th, on the House side, the committee responsible for their part of the budget reconciliation will take up Medicaid and start making decisions about what the number is they're going to produce for savings. So that's a very important day to watch. And, we will do our best to keep people informed on what's going on. But make no mistake about it. If you block grant, if you impose per capita caps, or you cut the federal medical assistance percentage, that's all the same as a benefit cut. And if nothing else has come from this process, and this is where advocacy has come into play very well. One thing I will say, and I've said it a number of times already, the days of doing global advocacy are over. The days of doing granular advocacy are here. Granular meaning the closer and more local data and stories you can produce on the impact of a given program and its value, the more effective you're going to be. And when the number of 700 billion got leaked out, people mobilized, galvanized beautifully to say that can't happen. We can't afford that. And as a result of that, you're not going to see that size happening, but we still have to be vigilant as the alternatives to that come forward. So I will say over and over again, Medicaid is facing the biggest threat of all these programs that we're talking about. Let's go to the next slide. And I'll pause. How we doing on anything on the Q&A? I hate to look at that. I would look at that chat, but if I look at that chat, I'll lose my whole train of thought because,
It's true. They're coming in fast.
They are.
There's a couple questions that came in. One of them was, who benefits from Medicare fraud? Just to clarify for someone.
Who benefits from Medicare fraud?
Mm-hmm.
Other people who commit it, probably. I mean, who are able to, I'm not going to point fingers at any particular sector, but there are people who have overcharged under Medicare, who have overbilled. And those are the people who will, would suffer if you do crack down on fraud, waste, and abuse. I remember 30 years ago at the White House Conference on Aging, when President Clinton addressed the conference, his major announcement that day was Operation Restore Trust, okay, which was a major new initiative to crack down on Medicare and Medicaid fraud, okay, which shows you how long this problem has been going on. But hopefully the right people will take the time and examine how to reform the programs to get rid of Medicare fraud and waste and abuse. Because it's definitely out there, but nobody seemed to have gotten their arms around it. And maybe we can be hopeful. Maybe this Musk group can figure out a way to achieve savings through cracking down that we haven't been able to do. But that is the key to a lot of these programs being not facing cuts, is to get rid of fraud, waste, and abuse.
There's another question. Is there a specific day in May that you think they will release the budget numbers?
Well, that's a complicated question because you've got two sets of budget numbers to think about. One is what is released relative to the budget reconciliation bill, and the other is the actual year-to-year funding levels that are produced in the budget. Okay, so on that second point, the president has not released his budget for fiscal year 26, which begins October 1st, making it very, very, very late. Okay, because the process begins with the president's budget, followed by Congress's action on the budget, and then they produce funding for all different federal programs, all that's supposed to get done by September 30th. We don't know when the president's budget is coming out. We have reason to believe it'll be in the month of May, but we can't precisely pick out a date. On the reconciliation process, like the Medicaid stuff, the tax cut stuff, their goal in the Congress is to have it done by Memorial Day. But if you know anything about Washington, every deadline they make gets wiped out almost immediately because there's just too much at stake in this large package to assume it can get done by the end of May. But that's the hope on the part of the leadership in Congress.
Another question. Does the proposal for reducing Medicaid using work requirements include older adults and dual eligibles?
It could. It depends on the language that they write it, how they write it. And we have not seen any exact language yet. But that's a good point to raise. And I know that advocates on both for older adults, individual disabilities, and others will be looking to see how the language is written. And I will say this much, for those, one of the things we need to do, if you take some time and look at your member of Congress, your House member and your Senate members, if they serve on either, in the House case, the Energy and Commerce Committee, or if they serve on the Finance Committee in the Senate, if they're on either of those committees, you should be in contact with them on that very question. Not so much the way you would write it, the question wouldn't be, you would want to say, don't have work requirements include, okay, and explain why. And, but we're all interested to see how that's going to be phrased, but we don't have any answers at this point. We have not seen any language. And until you see language, you can't make any comments.
Do one more question. This goes back to Social Security, and you talking about how they backtrack a lot of the changes. Somebody was wondering if there's like any scorecard that has been prepared. They're interested in letting adults with disabilities and older adults know what the real and final changes are, so they're prepared for the new normal.
Well, that book's still being written at this point. Okay, but let's assume that enough noise has been raised. I will tell you, I'll give the media some credit on this. Particularly, I think it was the New York Times that puts a picture on the front page of the New York Times of people standing in line at a Social Security office in Iowa, I think it was in Des Moines, that was suffering from shortage of staff, long wait times, as somebody pointed out in the chat. But that state has two very significant Republican senators who looked at that and saw their constituents standing there. Okay, that changes the dynamics. When you start focusing in on the day-to-day activities in a given congressional district or state, and proposals that lead to things like people standing in line to get benefits or being held for 6 hours on the phone, changes will come about. And that has begun to happen, and I think it's going to continue to happen, plus the fact that for the next 2 weeks, and keep this in mind, folks, from wherever you are on this webinar around the country, Congress is in recess. They're home for the next 2 weeks, okay? Now, I read about, and you read about some of these people not wanting to have town halls because they're afraid they're going to become crazy and whatever it may be. But you know what? Your senators and your House members live in your community. You could see them in a grocery store, you could see them at a Rotary Club, you could see them any number of places. Or they can go to their district office. But if you've got something on your mind that concerns you based on anything I've been talking about today or other people have said, this is really the time to communicate. Okay, if you've got access to local media and you can write a good letter to the editor, a good op-ed, whether you can get on social media, locally, whatever it may be. If you got something that you're hearing today, or that you've heard about before, that concerns you, okay? See, people are just coming in right. Yeah, all the advocates are coming to work here. I can see. See, I'm reading the damn chat, which I shouldn't be doing, but I can't help myself. What can I say? All right, so let's go back to some slides, and then I think we're going to have time later to maybe sort through these chats. So let's go to Medicare now. All right. Supposedly, and I wrote this first bullet with my fingers crossed that it's in a fairly quiet space at the moment, Medicare. No major reforms are being considered. Okay. It was thought that the Inflation Reduction Act that I talked about earlier was going to get repealed or get modified or whatever. And apparently that seems to have gone away. In fact, the administration has agreed to support the 15 drugs for negotiation under Medicare, are not seeking to change any of that. They're obviously not going to touch the $2,000 cap on out-of-pocket costs because so many people work to get that done. And, you got to remember one thing too, this is, sometimes we forget to put this in our slides. For those of you who care about this issue, who know older adults, who want to know about this cap, they have another provision called smoothing, which means you don't have to pay the $2,000 all at one time. You can pay it over the course of a year. Okay, you can do it on a monthly basis, a quarterly basis, whatever. So not only are you going to have lower out-of-pocket costs with this cap, but you can spread it out in such a way to lower the difficulty that you might have to achieve it. What are the questions that are still out there? Okay, the bill that passed Congress to keep government open after March 14th included a very short extension of telehealth benefits and hospital home benefits through September 30th. Whatever bills follow, a funding bill or maybe in this reconciliation bill, the hope is to have a much longer extension of both those programs beyond September 30th. How long? That's an open question. It could be a year, it could be 2 years. Nobody's quite sure, but there's bipartisan support for both telehealth and hospital home programs. What is the future of Medicare Advantage? Well, you have a new commissioner, a new administrator of the Centers for Medicare and Medicaid Services, Dr. Oz, who has been a big proponent of Medicare Advantage, has spoken as far as saying Medicare Advantage should be the default program for Medicare for people, for new enrollees. But Medicare Advantage has some other issues going on relative to prior authorization, number of cases in that area, some marketing issues. So you've got mixed feelings about Medicare Advantage they're going to be focused on by Congress this year. And the first year of implementation of age-friendly health system work under CMS, initiative led by the John A. Hartford Foundation. This is a very positive thing as states and as hospital systems comply with the age-friendly health systems. This is a very important direction for the future. And so far, the administration has not tampered with anything. They're letting the process go forward. And I think it's going to bear great results. And then, of course, you may have read recently that they overruled, the current administration overruled the prior administration's ability to have Medicare cover GLP obesity medications. But you got to read through the lines on that. They ruled against what the Biden people did, but they're going to come back with their own plan on Medicare coverage for GLP. So stay tuned on that one. Okay, let's go to the next slide and talk about something that is concerning us all. The Older Americans Act, and next to Medicaid, I think the Older Americans Act is under the second level of threat, if you will, and it's totally unexpected. Okay, and this is somebody you're talking to who's been around the Older Americans Act for a long time, and when the administration announced the reorganization of the entire Department of Health and Human Services, it had the following language, which you can read for yourself, but that is all that was given. Okay? Notwithstanding the significance of that move, taking the ACL, moving into 3 different agencies without providing any further explanation, has caused great uncertainty and confusion across the country. And then you follow that shortly thereafter with the announcement that 10,000 employees from the Department of Health and Human Services were going to be laid off, with no agency exempted, and the Administration for Community Living losing about 50% of their staff. Now, some have been rehired, but only through June 2nd at this point. So here are among the questions that we're trying to get answers to about the future of the Older Americans Act is which of the programs currently in the Older Americans Act will go to which of the three agencies that ACL is being absorbed into? Okay. Does the ACF get most of them? Does CMS get most of them? Does ASPE get most of them? Nobody's really sure. The thinking is that ACF will get a lot of them, but nothing has been written. Nothing has been provided as far as an explanation is concerned. And then you also asked the question, what aging leadership position will remain in this reorganization? There is a law passed in 1965 called the Older Americans Act that created the Administration on Aging to be the lead federal voice in the federal government on aging issues. The Assistant Secretary for Aging is the lead person in that agency. They are, under the law, confirmed by the Senate and report directly to the Secretary. But under this arrangement, we don't know what happens. And that's a major question. So then we go to the next slide and ask the next set of questions, which include, what about the reauthorization of the Old Americans Act? You know, we came in an earlier webinar we did this year, we talked about how close the Old Americans Act came to being reauthorized last year. I mean, it came to the point where the Senate did their job, passed a bill, 4-year reauthorization of this wonderful law, provided increases, all kinds of good things, but the House never finished, never got to the point of addressing it. So now, with this reorganization and these layoffs, is reauthorization a moot point, or is it even more compelling to do it? I still believe the failure to do it last year made it easier to do what they just did with reorganization and these layoffs. So this is where advocates are going to have to come into play again. It needs to be put back on the agenda, because then if you had a brand new law, that could supersede what this reorganization is doing. It could supersede these layoffs, but it needs to happen. And we're waiting to see who's going to make the first move. I think the Senate remains interested, but the House remains unclear. And I will also say the chances now of a 2025 White House Conference on Aging are probably moot at this point, because it would take a lot of work to plan one and get one executed during this year. And the last thing you want to have, if you want, is a poorly planned and a politicized White House Conference on Aging. We don't need either of those to happen this year. All right, let's go to the next slide. But I think I'm going to guess there may be some questions that are coming in on this point. So maybe I'll wait till Megan has a chance to look.
Sure. A couple questions to come in. What do we know about the future of the RAISE Advisory Panel and updates to the national strategy and efforts to implement and update it?
Well, we are assuming the continuation of the Advisory Council. I think they've had a meeting fairly recently, if I recall. But how the Family Caregiver Support Program is administered, the broader question, and whether this administration would allow the continuation of the RAISE Family Caregiver Initiative and the recommendations that came forward. They have not signaled too much in that space. I think there's enough of a advocacy space and voice in that area to allow that process to go forward. But it needs to be watched, because, again, you could undermine any initiative if you don't have proper staffing, okay? If you don't have proper people on board. And, you know, this administration is going after advisory councils right and left, using them as an excuse to say this is how you shrink government and how you lower costs. While I'm not seeing it directly yet in the RAISE space, everybody's got to watch it, particularly the advocates who are on this webinar, who work very hard. I know folks that are on here that work very hard in either as members of the council or getting the recommendations adopted or getting the RAISE thing done. But you got to also remember, a lot of the RAISE activities began in the first Trump administration. So maybe there's some connection there that could be utilized effectively. Anybody else?
I'll ask this real quick. How can area agencies on aging be sustained without OAA funding? What are alternatives that we can be advocating for if we see the writing on the wall that OAA may not be authorized? I'm
not going to go as far as saying OAA will not get authorized. Okay, first of all, you have to remember that there are many programs in the federal government that have not been reauthorized that continue to be funded, okay? Because once you have been funded, you're able to continue. I don't think the issue is about funding. I think the issue is more about the ability to, and here's what's going to come front and center on this one. What I'm told by folks in the field, I mentioned a bill that was passed on March 14th, a continuing resolution of guaranteed funding for the rest of the fiscal year for a whole range of federal programs. It normally takes 6 weeks from the time a bill is passed till the money starts to flow down from Washington into the states and down to the area agencies. If there is any interruption of that flow of money, okay, that's going to be the panic button time. That's going to be when people are going to have to really mobilize and start to tell the story. And I can tell this from a personal perspective. Myself and a number of our colleagues in leading aging organizations have been contacted by national media almost from the time that the layoffs and the reorganization came out. And we could give them projections and possible scenarios of what could happen. But the minute an older adult does not get a meal, okay, does not get the caregiver support, loses their job under CSEP, whatever it could be, whenever that starts to happen, then it takes a much different tone. And that's what the media is interested in doing. They want to focus on, the practical implications of things. Area agencies on aging, they're not going to disappear. They're not going to go away. They have in many ways. There's a vital cog in the setup of the aging network in this country. But what they're going to have to be able to do is be somewhat more adaptable to certain changes that are happening. And they're going to have to be much more focused on making sure that money flows as quickly as it can from Washington down to them. Okay. But the time period to be really looking at is this period probably through the end of this month and into next year when we get into May, to see, A, do we get more details on this reorganization? B, how many people from that 107 that got laid off in ACL will come back? And C, will there be a reauthorization effort started up again while waiting to see what the funding level for fiscal year 26 is going to be? But I'm very confident. I know the advocacy efforts that are being made by U.S. Aging. I deal with Sandy Markwood on almost a daily basis. We're in regular communication. We know how important the individual area agencies are, but they're very important in communicating to their elected people about the services. I believe, and I spoke to U.S. Aging at their conference a couple of weeks ago, and I looked at the audience of people and I said, what still surprises me as an advocate is how many older adults do not know what federal program gave them that service. Okay, where'd that meal come from? Okay, what federal, and it's time for us to have a Did You Know campaign. Did you know that the meals that are provided in caregiving and home delivery setting comes from the Older American Act? Did you know that the only federal program helping family caregivers comes from the Older Americans Act? Did you know the only federal program providing jobs for older workers, low-income older workers, comes from the Older Americans Act? That's the way to elevate AOA, ACL. It's got to get very local. And people need to understand how to do that. And we need our older adults. We need our older adults to speak out to when it comes to explaining the importance of these programs. So I gave that person a much longer answer to her question or his question, but I apologize. But that one I get concerned about. So, okay, let's see how we're doing here. Good. All right. So let's talk about the ACA again briefly. Again, like Medicare, everything is relative in this term. It's more secure than it was a year ago. And what's keeping this program functioning is how many people enrolled in this program over its history. The numbers are phenomenal. Okay. The one thing that does concern people, and the one thing that could be impacted, is the premium subsidy, which could expire at the end of 2025. And the net result, if the premium subsidy is changed or eliminated, is higher premiums for people and higher rates of uninsured people in America if we go forward. So it isn't clear right now what's going to happen with that. It's being discussed. It's on the table. But again, for those people who are benefiting from the premium subsidy, it's time to drill down to find out who those people are and make sure that they're speaking out about why that is important to them from a health standpoint and from an economic standpoint. Next slide, Elder Justice Act, the summer, okay? Another place that's uncertain, okay? Here's an example of a program that has been unauthorized for 11 years, but it still continues to get funded. But bringing back the Musk people, or the Musketeers as I call them sometimes, when I'm getting fresh, if you have not been authorized, you could be a target for them to say, hey, if they can't get authorized, then they shouldn't be funded. I think a lot of that has calmed down from where they started, but you got to keep your eye on that. But right now, the top issue in elder justice space is funding for adult protective services, both in the Older Americans Act and another area that has not gotten a lot of attention except from a group of people here in Washington, the Social Services Block Grant, okay? That is a hugely important program that provides the main funding source for adult protective services, for child protective services. It provides hundreds of thousands of Meals on Wheels as well. But again, a document was floated around from the House side suggesting they want to eliminate the SSBG. We have got assurances from the Senate they will do nothing of the kind, but it needs to be maintained at least at its current level, cannot afford to have any cuts. And for APS to get adequate funding, the Social Services Block Grant must continue. The Long-Term Care Ombudsman funding levels, and they're run by the Older Americans Act. And they're moving into assisted living now. Okay, it's not just nursing homes; they're in assisted living, and that provides they need more resources to do their job in that space as well. And as I mentioned earlier, the process for getting funding levels established for the fiscal year begins October 1st is underway now. But there's a long way to go before we would know what those numbers are. And then just to get the Elder Justice Act itself renewed is a challenge because we cannot seem to find any Republican to get on the reauthorization of the Elder Justice Act. We're grateful for Senator Wyden and Congressman Richie Neal from Massachusetts for their leadership in putting a bill forward. And our job with the Elder Justice Coalition, along with Benjamin Rose, is to get Republican support on this bill so it can move. And as we mentioned, we want to keep the Elder Justice Coordinating Council going, and we're advocating for its continuation. Okay, let's see what's next. Quickly, there are some other elder justice issues I do want to bring up since this is the coalition. We also are troubled by the layoffs and the reorganization because ACL, the Administration for Community Living, has expertise in dealing with elder abuse prevention. The Administration on Aging has been doing it for years, okay? And you take one agency that has expertise and move into 3 different agencies that have very little expertise in the area of elder abuse prevention. That's not a good picture. That is not a good picture. And one of the things that we're doing, we're trying to separate this issue from the other issues within the Older Americans Act and ACL, and get our friends in the Congress, particularly the Aging Committee, to say, look, let's take a look at this. We're weakening our effort at fighting elder abuse if we go forward with this reorganization. We need to have the people who understand the programs. We can't be having these programs sit in limbo. So we are working this particularly very hard, and we're very concerned about the impact of this reorganization and layoffs on elder justice. And then next slide talks about something else that concerns us. There was a proposal put forward by the Biden administration for a minimum staffing rule in nursing homes, which took forever to get done. A lot of work was done, a lot of advocacy was done. A judge recently came out and found it to be illegal, or I forget the term that the judge used. But what concerns a lot of us is that there is when you talk about passing a tax cut bill, you got to pay for tax cuts, right? And somebody said you could pick up $22 billion, I think the number was, that if you didn't let this staffing rule go forward. And if they start to use it as a pay for, that's going to present a lot of challenges. So this is where the advocates who push so hard to get this staffing rule done are going to have to redouble their efforts to keep it on the books. And then finally, this last one still amazes me beyond belief. If you are an individual who was scammed out of $100,000, lost that money completely. When the time comes for your taxes, you're taxed as if you still had the money, which is absurd, which is absolutely absurd. So there is a very important bill in the Congress, Congressman Raskin and Congressman McGovern and Senator Baldwin and Senator Welch have a bill to provide tax relief for these victims of crime, scams, and disasters. And we are working like hell, and I'm going to say like hell, like I don't care, to get this included in the tax bill, because that is basically tax reform at the highest level. So we're going to go to the last slide, folks. And then we'll see if we have the bravery to go into that chat space, because it's pretty active in there, I can see. So when we first arranged this, we had no idea what this year was going to bring. And now we see these celebrations are being a little tempered by the uncertainty about the future. But you know what? Use this as an advocacy opportunity. Because if it's about messaging, right? Which a lot of this stuff about policy is about messaging. Who's got the proper message? Okay, value is still a very important word in our vocabulary. The value of Social Security and Medicare and Medicaid. The return on investment. Okay, the powers that be love that term. Okay, who can stand up taller than the Older Americans Act as being a great return on investment? Okay, for those people who get their meals in the community, who don't get them in nursing, how much are we saving? How much are we saving Medicare and Medicaid every year by having the Older Americans Act? And then, many of you on this webinar know this. Aging policy is not for just one age group. It's for all ages. It's building an intergenerational society. Yes, we care about the people who are currently on Medicare, but we want the Medicare of the future to be there and be strong for the next generation. Same thing with Social Security. So, you know what? Don't leave this webinar and just say happy anniversary. Raise your voice to make sure we have some more anniversaries to celebrate. And I'll stop there and let's get brave now and see what is in there from among these many people who are on this web. I see 70 items in the chat. My goodness. That is pretty amazing. Orion, I want to make sure you get the last word on any comments on what I had to say or additional thoughts.
Well, I think one of the things that's important in these conversations about the advocacy on this is to also make sure that you're talking to your state officials as well, because they also have to understand Medicaid and the Older Americans Act and these programs, because almost all of these things we've talked, not Medicare and Social Security, but the other programs you've talked about, all pass through state units on aging, state departments on aging. They flow into state budgets. And tell you that in Ohio, there's a lot of nervousness, across districts, because we're more red than blue in Ohio. But in rural communities that went heavily for Trump or very heavily Republican. A lot of concern about what happens to the rural hospital, what happens to their rural multi-service agency that has the aging, the AAAs and those kind of programs in them. So as you have this conversation, have it with the federal people, but also make sure that you're talking to your folks at the state level about the interventions there, because their budget folks are concerned about these things as well, and that may be important leverage in these conversations going forward.
That's a very important point. When you consider that matching funds are necessary for a lot of these programs to continue, you also have to contend that states have their own challenges now. Ever since the pandemic monies that went away, there are more states facing deficits than ever before. And also, there is synergy between the legislative people in your capital and the ones in the United States Capitol. A lot of them came from those ranks. And so you're right. The more you can have your local state legislative person be an advocate with you, as you are with them, understanding the combination of the two sources of resources are very important. All right, let's see.
Yeah, where do we start?
I'm loving these. I'm loving this stuff. I mean, really, if I could open this thing up, I'd be tempted to go talk to everybody's comment. But the ones I've seen have all been very valid here. And
Is there anyone that,
I hope there are some silver-haired legislators still around. I used to be the head of the advisory committee of the National Silver-Haired Congress years ago, and those people, they were genuine advocates. Boy, they were great. They would, they would travel and go all over the states and make themselves heard. They had sessions every year, but they had it down, and which is great. So, yes, Sarah, yeah, I agree with you. All right, Megan, this is your show. Let me get off this thing
I
here.
didn't know if there was any of them that you wanted to address that you saw coming in. Otherwise, I'll just do my best to pick some.
I'm all right. I mean, as I see them come in, she's right. Yes, there's go to your counties, go to your state associations that represent rural. Understand any group that you're part of. But yeah, reaching out as wide as you can in advocacy is very important.
Do we have some data? What was that, Orion?
In a comment about some comparison data for the savings for home care versus institutional care and some of that information. And one of the sources, and we'll find a link and send it out to people, but Jim Earth Financial does some studies every year that shows a breakout of relative cost of home care, assisted living to institutional care. That can be useful data for some comparisons in that space.
Yeah.
Which can also be some good advocacy around. There was a question about the impact on PACE programs,
Right.
adult day programs, and some of those services where they show some, based on claims data, some of the costs of some things there. Those can be useful tools. Taking advantage of what the actuaries can tell people about some of the programs and the cost benefit.
Right. Yes, I mean, I think yeah, you were breaking up a little bit just then, Orion, but I think I understand the gist of it. We'll look for those kind of data you're talking about, home care costs versus institutional care costs and other stuff. I would point out on the PACE side, they put out a very cryptic sort of note about, they meaning the administration, about going through a review and review of PACE programs and their management. I don't know what that means. We're trying to get more information about that. But the other thing I got to say, and I've said this before, and I will continue to say it, is that yes, the things that we know about concern us, but don't chase after every story or rumor you hear and think it's fact, because some of these things will take a long time before they see the light of day. Sometimes they're just designed to provoke, whatever it may be. So be reasonable in your approach of looking at things, and ask folks, who know more, perhaps who have more insight, to find out what that really means. Because I've seen things, people get really out of upset about things that never really were going to materialize.
I have a couple questions from Q&A from Peter Whitehouse. Children are future elders if they can make it. Can intergenerational advocacy for the vulnerable emerge?
Oh my goodness, yes. I mean, I think it has. I think it could do more. I think that, again, it's the intergenerational. Right now, we're focusing about the impact of things. The impact if you do this and that, which are more negative than is positive at the moment. But at the same time, if you demonstrate on an intergenerational basis what a federal program means, what impact it has on the quality of life of people at different ages. Medicaid is a perfect example of that. And bond together. I mean, I know that, I'm very close to my friends at Generations United. I know the work that they do in the advocacy space. But I'll give you a good example. And I want to shout out to Allison Barkoff, the previous administrator for ACL under the Biden administration. She's convening a very important meeting tomorrow involving aging leadership and disability leadership, and I'm pretty sure that the Generation United is in this group as well, to talk about a combined strategy for dealing with these issues that we talked about, the reorganization, the layoffs, things of that nature. Because the louder voices are, and then you got to do is take it to those members of Congress that have been in your corner, and share your information with them, your strategy with them. But, the reason why, we got to remember when Generations United was formed, it was AARP, the National Council on Aging, the Children's Defense Fund, and the Child Welfare League. Those four groups founded Generations United, and they still work that way. They still work in that fashion, and more of that will happen. But anybody has suggestions on how to do that better, we're always amenable to that. Oh my God, we're almost at 100 in the chat. Look at that, 99. No, it says 99 plus. Maybe they can't even put 100 on there anymore.
Another
Do I
question.
think the April 5th protest? Yes. Do I think the April 5th protest had any impact? Yes, I do. Because of the way they were done organically across the country with wider numbers of people than were expected in a number of communities. And the civil nature of those demonstrations were remarkable. People were very focused, had brilliant signs, concise messaging, okay, that resonated in front of things like the media. Okay, when they were covering those demonstrations, they were picking up those signs, and who looks at the media more than anybody? Elected people, elected officials. Okay, if they see this activity going on in their space and they begin to see what the message is, that was a brilliant organizational effort, and I hope those of you on this webinar who were there, thank you for doing it. Thank you for making that voice heard, and I'm sure there'll be more because it was very important.
Another question from Q&A. What have you seen that makes you most worried about the certainty of Medicaid cuts?
What have I seen that makes me most worried? Well, if you asked me that question a month ago or 3 weeks ago, I would have said that $700 billion number that was floating around as if it was a gospel truth, as if that was really going to happen. Okay, and that worried me. But guess what? It worried so many other people that they were forced to backtrack and say, no, we can't afford to do that to Medicaid. Even the president said on more than one occasion that they have no intention of cutting Medicaid benefits. Okay, and there's things that people say that they have to be held accountable for. Okay, and the Senate, let's just talk about one number, just to put things in context. The Senate, the committee that produces Medicaid in the House, they asked for $880 billion in savings in their budget reconciliation plan. The Senate asked for $1 billion in savings. I mean, that's huge, right? Which is why the advocates have been saying, let the Senate numbers prevail. They will be more reasonable. They will not cut into benefits. But if I see some wavering on the part of the Senate when they get down to the negotiations toward achieving a final bill, then I will get worried. But I think if I were anybody on this webinar, monitor your senator's behavior. No, excuse me, that's a bad thing to say. Monitor your senator's behavior. That sounds worse than it should be. Monitor their activities on this whole question about Medicaid and the budget reconciliation process. This is a defining moment for 2025. This is a defining moment for the current makeup of the Congress in terms of if there were significant cuts applied to Medicaid that cut benefits, you will see next year in 2026, you could see the House flipping back to the Democrats solely on that basis. Okay. And if you have a divided government again, boy, it'll be a whole different world than you have right now. So Medicaid to me is a front and center issue that we really have got to get dealt with, addressed, and come out the right way on this.
Another question from Q&A. What do you see emerging from the UN and WHO about the rights of elders and any impact such activities might have nationally?
Well, I do understand that there was some part of a breakthrough recently where a United Nations Convention on Human Rights of Older Adults is moving forward. There are more experts than me who know more than I do about this, but I have read some things and I've been involved in some conversations. Apparently, there's a greater understanding and acceptance of moving toward an international convention on human rights of older adults. Well, we have to make sure, let's assume that there is sentiment to go forward with that. We got to have the United States ratify and agree with this notion of a convention. we have a tendency not to agree with these things sometimes. And that's a Senate position. The Senate decides, if it's about it, whether it's a treaty or a convention, the Senate has to weigh in on this. But I believe I'm going to throw my good friend Ramsey Alwyn, who runs the National Council on Aging. She's monitoring this pretty closely. If people want to check on the current status of the UN Convention for on Human Rights for Older Adults, might want to check with her. Or go to NCOA's site. They probably have some materials up on that. But there is movement definitely going on.
Going back to chat here, have you heard anything about AARP mobilizing to help reauthorization and funding OAA?
Well, I'm not speaking for them today, obviously, even though I'm a board member, but I do know that they have great concern and advocacy interest in having the Older Americans Act reauthorized. They were there last year. At the moment, we're all pushing for that to happen. We know that, again, as I said earlier, the failure to get it done because had you gotten a reauthorization done in 2024, you couldn't fool with reorganization as was proposed by this administration or these layoffs. You'd have a law freshly approved that would reinforce the importance of ACL as an agency representing the disability and the aging world, reinforce the importance of the Older Americans Act and the Assistant Secretary of Aging position. But because it's out there in that limbo status, not being technically authorized, that gave them a chance to come in and play. So to me, that provides the incentive for the House and the Senate to work to get a reauthorized Older Americans Act and clarify, or if anything, supersede what they're trying to do through this reorganization. So AR play an important role, but folks can always communicate with their state offices and urge them to do more. Why was it not reauthorized last year? Very simple. The House of Representatives refused to do their job. As basic and blunt as I can make it. Okay, it takes two to tango in Congress. Both the House and the Senate have to pass something before it goes to the president for a signature. The Senate did a remarkably good job last year. They had 8 senators on a bipartisan basis working to produce S4776, which was a wonderful bill to reauthorize the act for 4 years, give it increases. But this House just never started at all and had that one chance in December. After the Senate actually passed that bill, they had 2 or 3 days to decide to do something about it, to get it onto the final end of year package. And they didn't do it. So there's your answer.
Would you comment on the effects of the cuts to NIA and NIH, especially on Alzheimer's and other research efforts?
That's a major concern. That's a major concern that we're still not seeing the whole picture on that yet. But we do know that the efforts to shrink the number of institutes in the National Institute of Health and to freeze spending and stop contracts and stop grants from going forward will have a huge impact if allowed to go forward in our area, not only in the Alzheimer's space, but all the research that we're doing in different parts of our health system. Research is as vital as anything we do in this country in the area of healthcare. Okay, the more research we can do and learn more, the better we are as a country. There is just a misconception, for lack of a better term, about NIH on the part of some people in this administration who are wielding more power than they should. And I think it all goes back to how demonized they were during the pandemic. Okay, and I think the whole agency is suffering because of the activities that people view the response from the pandemic and all the other stuff. And NIA worries me a little bit more too, because there was a bill floated around out to change the name of NIA and have it focus almost only on Alzheimer's. That's a huge important area for us to focus on, but National Institute on Aging is a broader mandate and has to cover all the bases that it has. So again, I will point to you as, for your people on this webinar, if your member of Congress is on the Senate Health, Education, Labor, and Pensions Committee, okay, or is on the Ways and Means Committee or Energy and Commerce Committee in the House, they have oversight into NIH and NIA. And if you have concerns about what you're hearing, communicate that. And if you have, direct knowledge, or perhaps you're even a grantee of some kind or someone involved in it, make sure you communicate that, because it's easy to point things and cast a wide net on things and then have unintended consequences happen. The one thing I will say, NIH in particular has a lot of strong support in the Congress and has for years. And a lot of those people are still here. And so I don't think the ability to come in and do it to decimate NIH would work. But you've got to be careful. Again, if you weaken an agency by layoffs or reorganizations, or stopping grants, stopping research in its tracks, you've got situations going on where that important research, like at Columbia University on obesity that I saw and other things, they're stopping these things cold in their tracks. Some of this is going to get resolved by courts. Okay, make no mistake about it. This administration is pushing the envelope as hard as you possibly can. But there are courts that are going to come in and make some determinations about what they can do and what they can't do. So keep that in mind as we go forward.
I'd say we have time for one more question. There's one in Q&A. Is there some recommended advocacy groups in Ohio to attach to? I don't know if Orion, you want to take that.
So yeah, I can tell you some of the ones that we talk to a lot. AARP Ohio has some great grassroots advocacy and connections, and they also do State House days and promotions in that space. We work with them a lot. There's a group that's based here in Cleveland called the Center for Community Solutions that's done some great policy work around Medicaid and some of the impacts that would have in the state of Ohio, and they have a aging focus in some of their research. And of course, the O4A, the Association for Area Agencies on Aging in Ohio, is another great resource. Of course, the AAAs are all members of that, but they have some good information on their webpage at O4A, and some good advocacy efforts in that space. And you should always reach out to your local area agency and find out what they're doing and who they're talking with. And they all have some advocacy messaging in their work in that space. And finally, another one that we talk to a lot in Ohio is Leading Age Ohio. There's, in addition to the National Leading Age Organization, there are state programs. Many multi-service agencies like Benjamin Rose are members of Leading Age Ohio, so it does include some community programs like Meals on Wheels and day programs and affordable housing and other things. It's not just the skilled care environment. And most of the time we get along with those folks. Every once in a while you can tell the membership of the institutional care provider has a little different focus than those of us who focus on the community supports, but they also have a great presence in the state, some really good advocacy efforts, and collaborate with a lot of community organizations like us across the space. So those are all good ones that we talk to on a regular basis, and you may know of others, but those are ones with a statewide footprint that probably have some involvement in your local community, your local county.
Right. Well, first of all, Megan, thank you, and Julie, thank you. We couldn't have got through this without both of you, and it's been yeah, there we go. Thank you. I'm going to keep that up for a second because I'd love to look at all 99 plus items in the chat, but that doesn't necessarily get me connected to you. So while this is up, and keep this up if you can, as long as you can. Those of you taking time to write in the chat, you can also just write to me at that address, and we'll be happy to try to do our best to respond to what you're asking about or what you're commenting on. But I will say what I saw come in from the correction early on about billions versus millions to things that have flown in since then have been very perceptive comments, and it makes it all worthwhile. So thank you for the chance to do this today.
Thank you, Bob. We always appreciate your time and your expertise. It's always a great conversation, even when the topic might be a little difficult. Thanks so much.
Thank you very much. Thank you, everybody.
Thank you. Thank you all for joining us today. And I just thank you, Bob, again for providing the informative presentation. In the chat, you will find a link for our webinar evaluation that we hope you will complete. Your feedback is important to us as it helps us to improve our programming. Any responses will be kept confidential and will not identify you in any way. And we hope you will join us again for future events. This upcoming Monday, April 21st, you can join us to learn more about the financial fatigue of caregiving from 12 to 1 p.m. EST. On Wednesday, May 14th from 3:30 to 4:30, we will be hosting our next BRI Care Consultation Learning Collaborative about understanding frontotemporal degeneration. You can also join us for our annual CATS policy lecture, Advancing Dementia Care. It will be on June 17th from 1 to 3 p.m. EST. Our keynote speaker, Dr. David Rubin, will discuss groundbreaking research and innovations in dementia care, including findings from the Dementia Care Study or DCARE study, and the Guiding Improved Dementia Experience or GUIDE payment model. You can register for all of our virtual events on our website at www.benrose.org. And there you can also find more information about all of our Benjamin Rose research services and programs. Thank you so much, and we hope you have a great rest of your day.